Having undergone specialist training in Moorfields Eye Hospital in United Kingdom, I had returned to my hometown of Ipoh in 1974 with the aim of providing affordable, quality eye care services to my patients. LEC Eye Clinic was founded at that time, and from being a solo eye care practitioner in this clinic, LEC Eye Centre was subsequently born in 1999 with the inclusion of 2 other consultant eye surgeons. Since then, we have grown to become a Ministry of Health recognized day surgical centre, and to date, LEC Eye Centre is the largest private group practice in Perak with 4 consultant eye surgeons.
LEC Eye Centre is a one-stop comprehensive eye specialist centre, and we're able to cater to all the eye care needs of our patients. We pride ourselves in having the most advanced technology to provide the best outcomes for all our patients. We have premium cataract surgical services, and this involves the acquisition of the first Lenstar optical biometer in Perak, which is actually a laser machine used to measure the eye before cataract surgery. We also have another advanced machine called the Varion Image Guided System, which is actually a precision machine that provides digital marking during cataract surgery. Now, aside from this, we also provide retinal services, and this includes the management of retinal detachment, age-related macular degeneration, and diabetic eye disease. We acquired the first in Malaysia sweat source OCT angiogram, and this actually allows us to take high-definition images of the retina and better manage these diseases. We also want to make sure that we are always accessible to all our patients, and they can make appointments to see us with a click of a button via our online appointment system.
At LEC Eye Centre, we have our in-house optometrists who are vision care experts responsible for accurate testing of spectacle power as well as contact lens fitting. They also provide vital support to our LASIK services. At LEC Eye Centre, we acquired the first in Asia wave-like refractive suite in 2011. One of the fastest lasers in the market, this unique all-in-one suite connects the machines used to measure the eyes before surgery with the laser machines, so all treatment information is sent wirelessly and allows surgery to proceed seamlessly and with unparalleled precision.
At LEC Eye Centre, we recognize the increasing problems of nearsightedness or myopia amongst children nowadays, and we have in place a myopia control program to combat this. This program involves the use of myopin and eye drop, which has been found to be effective in slowing down the progression of myopia in children. So this program aims to increase awareness about myopia and allows our team of doctors, optometrists and nurses to work closely with parents to manage this epidemic which is sweeping the world. A key component of this program is the use of appropriately prescribed eyeglasses, for which our subsidiary company, Eye Care Optical, will be able to provide. Aside from children eyewear, a wide range of adult eyewear is also available.
evening, everyone. Thank you for joining us. Just give me a minute. I would like to share Facebook Live. All right. Apologize for the delay just now. Okay. For those, I would appreciate, yeah, I think everyone have their name here. All right, thank you. Thank you for joining us. Today, we're going to have the topic is about blindness from diabetes. And as for those who have actually watched our video just now, that we actually, due to the recurrent wave of this pandemic, we actually adhere to the proper SOP on the sanitization and also the social distancing among the patient and also our team. So in order for those who are not comfortable to leave their home to come and see our doctors, so we also have this teleconsultation. All right, let me share you the screen. We also have this teleconsultation. So our teleconsultation, because due to the current situation, we also would like to help our patients. So if you like to, can you see the screen? Can everyone see the screen? If you can see the teleconsultation screen, I will appreciate you can type into our chats. Can you see the screen? All right, so this is a teleconsultation. So if you would like to find out more how you can book an appointment to have a teleconsultation with our doctors, so you can actually make the appointment and we'll do a teleconsultation with our doctors. And it's actually free of charge, okay? And then for those patients who actually have need to continue their medication or eye drop, all right? So you can also, we can also courier your eye drops to your doorstep. So in conjunction with this World Sight Day, all right, in conjunction with World Sight Day, which is on the 8th of October this year, and the theme is Hope in Sight. We also would like to offer, we would like to give back to the community with this CSR program. So for all the attendees who actually attend our this webinar, either via the Zoom or our Facebook Live, we will later send you a link for a free eye screening. All right, so all attendees were actually entitled of a free eye screening and including our doctor consultation. So without much further ado, let me have a brief introduction of Dr. Lee. All right, our speaker for tonight. Can you see my screen, which is Dr. Lee? All right, so Dr. Lee is actually our medical director, and he actually graduated from University of Manchester, UK. And he had his ophthalmic training in Singapore National Eye Centre and his retina fellowship in Western Australia in LEC Eye Institute. So currently he is also a visiting consultant in Perak Community Specialist Hospital, as well as a KPJ Ipoh Specialist Hospital. So let's welcome Dr. Lee. Hi, Dr. Lee.
Hi, hello. Good evening, everyone. I think, okay, so welcome to all the attendees in, I think this is our 1, 2, 3, this is our 4th installment, right, of the LEC webinar series. And like Anna mentioned, so today, actually, we're doing this in conjunction with World Sight Day. So World Sight Day is actually a day that has been highlighted by the International Agency for Prevention of Blindness. Actually, it's something that happens every year. So it's the second Thursday of October. And what happens is we always have some activities in LEC to commemorate this so that we bring awareness to the public about blindness, really. So this year, no different. I think we are doing things differently for the past, 8 months now because of what's happening around the world. So the webinar is as good a platform as it is now to do this. And also we are going on Facebook Live and YouTube Live. These kind of things are becoming more commonplace. So I hope all the attendees who are actually present with us tonight, thank you for coming in. And any questions, please, in the Zoom platform, please post on the chat, or you can even ask questions afterwards when I finish. And on Facebook Live, you can post in the comments, similarly in YouTube Live. So we have people monitoring and they put their questions forward. Okay, I'm going to share my screen because today I'm going to talk about something which I feel is affecting all of us, and it's a very important topic, and it's something that's going to be close to most people's heart because diabetes is amongst us, and possibly there could be as many as 20% within the group that's watching this talk now that could be or is already diabetic. So as I mentioned, blindness from diabetes, we're going to talk about this today. Hope in Sight is the theme for World Sight Day this year. Every year they have a slogan, and this year is Hope in Sight, which actually there is hope in the sense that we like to share the fact that if you look after yourselves well and you're aware of how things can affect your eyes, there's always hope to prevent blindness, and we should be able to do that. So I think we've seen a lot of videos, so I'm not going to go too much into all this presentation or introductory slides. I think we've been in EPO 40 plus years, coming to 50 years now, and we have been around for a long time. This is our setup. Currently, we are a self-sufficient day surgery center with our own clinic and lots of equipment, lots of toys, shall we call it, but they are very important equipment to help us deliver care to our patients. We have own surgical suite, we have a day surgical ward, and you just now saw in the video also, this is our operating setup, and this is what we do. I'll be sharing some videos afterwards, short clips of some surgical videos. I hope for those of you who are a little bit gully, you might want to turn away, you just had dinner, you don't want to make you throw up or anything, but this is how we operate. We look through a microscope. So this is microsurgery, and that's what we do for eye surgery. So I'm a eye consultant ophthalmologist. A very long word just means I'm an eye doctor. I'm also a retinal specialist, so I look after the nerve layer of the eye, the retina. I'll go into that more detail. And there you go. So my topic today is blindness from diabetes. So I'm going to play a little video now, and this video is going to tell you a bit about diabetes. This is a YouTube video. It's not my own. It's from Diabetes UK, and I found that it just tells you very quickly
There are two main
about
types
diabetes.
of diabetes, type 1 and type 2. They're different conditions, but they're both serious. There are some other rarer types of diabetes too. What all types of diabetes have in common is that they cause people to have too much glucose in their blood. But we all need some glucose. It's what gives us our energy. We get glucose when our bodies break down the carbohydrates that we eat or drink, and that glucose is released into our blood. We also need a hormone called insulin. It's made by our pancreas, and it's insulin that allows the glucose in our blood to enter our cells and fuel our bodies. If you don't have diabetes, your pancreas senses when glucose has entered your bloodstream and releases the right amount of insulin so the glucose can get into your cells. But if you have diabetes, this system doesn't work. When you've got type 1 diabetes, you can't make any insulin at all. If you've got type 2 diabetes, it's a bit different. The insulin you make either can't work effectively or you can't produce enough of it. In both types of diabetes, because glucose can't get into your cells, it begins to build up in your blood. And too much glucose in your blood causes a lot of different problems. To begin with, it leads to diabetes symptoms like having to wee a lot, being incredibly thirsty, and feeling very tired. You may also lose weight, get infections like thrush, or suffer from slow healing wounds. Over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, people can live a healthy life. And there's much less risk that someone will experience these complications.
Okay, so that was a very short video, which I felt could actually give you a very good summary of diabetes. Now, I think Malaysia has got, whether you call it a good thing or not, we are actually a top 10 in something. So we are the top 10 in terms of the country over here as highlighted with diabetes. So this is a prediction coming from one of these studies that's been published. So these numbers here, as you say, from 2007 to 2025, is basically a prediction or a measurement of the people with diabetes and what they expect for the future. So Malaysia is here. So these are actually, if you add 3 more zeros, so for example, in 2007, you actually have 1.5 million people with diabetes. 2025, you expect almost double, 2.7 million. So this is a problem that we're going to be facing moving forward because they don't see any of it slowing down unless we do something about the way we live. Diabetes in Malaysia. Now, I think we must admit, I think for us Malaysians, that we can call Malaysia a proper food heaven. I think we are very lucky in the sense that, you know, the variety of food that we have here is unparalleled. I think my wife, who's actually not from Malaysia, always mentions that she understands why when Malaysians go overseas, they really miss their food. Why? Because we have food that's really good and really tasty and flavorful. So this is an example of what we eat, I think, on a daily basis. Funny thing is, any 3 of these things could be breakfast, lunch, dinner, or supper. I mean, you can eat any of these any time of the day and it's available. So this could be a problem as to why our diabetes is also soaring. Now, we also have a 3G problem in Malaysia. I think you heard about 4G, you heard about 5G coming in from China and all that. But we have a 3G problem in Malaysia, and it might not be what you think, but what it is, if you know Malay, we have this 3G of gebu, gempal, and gemuk. So gebu is fluffy, gempal is chubby, and gemuk is fat, of course. So we have this problem. And this is an article in the newspaper that I found is talking about, you know, the problem with obesity in this country as well. I think obesity is worldwide. It is actually another pandemic, if you want to call it that. And it's all based on the lifestyles and how you can say we are suffering from the progress that we're making as humans. So we are eating more comfortably and less healthily. This is again a study that was done, I think, in Malaysia. There is a good setup in the sense that there are people that take census and survey of our population. And you can look over here. This is a National Health and Morbidity Survey that looks at people with lifestyle diseases like hypertension or cholesterol. Diabetes is one of them. So from 1996 over here to 2015. So this is 1996. And you look down here on the x-axis is the age, and on the y-axis is the percentage of people in that age group with diabetes. And this is scary in the sense that if you look at the black line, which is 2015, compare it to 1996, which is 20 years ago, you look at people, for example, in their 60s, from 18%, you got 38% of people who are diabetic. So that is more than a double jump. So that in 20 years, so are you saying in 20 years time, 75% of people will be diabetic? Well, we hope not, but that is a worrying trend that we see in Malaysia itself. Now, if you look at ethnicity, so we have the 3 major ethnic groups, Malay, Chinese, Indian. Of course, you've got the other Bumi Putras and the others as well that live amongst us. Not that big a difference. We all are diabetic, but you know, the Indian race does unfortunately shoot up in terms of the percentage of people with diabetes. But it is a problem in the sense that all of us do suffer from it. If you look at states, I think Perak is right there in the middle. I think over here, this data is probably from about 4 or 5 years ago, 20%. So 19.4% has diabetes. But don't forget this group that's in purple is IFG, impaired fasting glucose, means that you are already pre-diabetic. And there's a whole group that's undiagnosed as well. So if you add those together, those are big numbers that we're looking at, which could be close to 20, 25, 30% even. So like I said, in this group of maybe 30, 40 people amongst us, 1/3 of us may be diabetic or may be going to be diabetic in future based on the statistics. So what is the problem with diabetes? Not when we are young, we think we are always healthy and we don't think about problems. But if you get diabetes early, these are the complications you can get. So on the left side is what you call microvascular, or they affect all the small vessels in the body. The eye is one of them. I'll go into that in more detail. The kidney is the other. And you get to affect all the small nerves as well, which affect your feet and your sensation. That's why people end up with amputations and they lose their limbs. The macrovascular, the bigger blood vessels, is when you can get heart problems. You can actually get problems with blood supply to the big limbs and the big organs, as well as to your brain. That can get strokes as well. So diabetes is no joke because it's something that you're stuck with for the rest of your life, and you got all these problems that could be facing you. So let's jump straight to the eye because that's my area of expertise. So how does the eye work? Very basically, just want to let you know that the eye itself works like a camera. I think in the old style camera, I think nowadays none of us have a film camera anymore. But if you think about the old style camera, we have a lens in the front, which is the cornea, and the lens itself, our own lens that focuses light onto the film. And the film here in the eyeball is like the nerve layer or the retina. So that acts as a film of a camera. So that's very important, obviously. So how does diabetes affect your eyes? So there are many ways that you can do so. I'm going to highlight just a few. Diabetic retinopathy, this long-term just refers to the fact that just now I showed you the nerve layer or the retina. They have a lot of blood vessels. And if you saw in that video earlier, I talked about diabetes. What happens, you get glucose or sugar buildup in your blood vessels, and that damages all the organs that actually the blood vessel supplies. So in this case, the retina. It can also increase your risk of cataract and glaucoma. It can cause dry eyes, and it can also result in eye movement problems because of nerve problems affecting the muscles of moving the eye. But the most common three things are what I will focus on in today's webinar. First thing, diabetic retinopathy. So this actually is a photo of a normal eye. Actually, this is my eye. Okay, I had a photo taken a while back. This is the nerve of the eye. This little roundish orangey thing is actually the nerve coming in from the brain into our eyeball. So this photo is obtained when we put eye drops to dilate the pupil. Then we put you in front of a camera and we take a photo, and this is how it looks. So these blood vessels here are reddish lines that you see, and the whole thing actually is a background of orange because all that orange actually comes from the fine blood vessels which are carrying blood, which is red color, and gives you this orangey color. The center part is very important. This is called the macula, but it actually means the center part of your vision. So this is the area that we use 90% of the time. Right now, looking at me, talking to you, you are using your macula. That's how you see things clearly. The rest of the other parts of the eye gives you all the side vision so that you can walk around without bumping into things and things like that. So what happens in retinopathy? This is an eye with diabetic retinopathy. So this again shows you the nerve and then the blood vessels, but you see all these blotchy red patches and yellowish patches that actually come around. And these are all leaking from the fine blood vessels. So you have blood that's leaked out, that's why it looks blotchy. And you have these yellow spots, which are protein material that leak out from the actual blood vessels, because our blood consists of just not red blood cells, got other proteins as well. So it's what happens when it leaks out. So retinopathy is how this affects our vision. Now, in advanced disease, besides just leaking, you can see here, this is an eye where actually because the blood vessels are so damaged, it cannot provide supply of oxygen and nutrients to the rest of the retina. So the eye tries to grow itself new blood vessels to get the oxygen through, and these abnormal blood vessels tend to bleed. So what happens, they try to improve the blood flow, but the blood vessels that grow out all are abnormal and tend to bleed even more, and it just becomes a vicious circle. So this is when you get bleeding in the eye. And in the worst case scenario, this is a very bad case where you get a lot of bleeding. And as I will always explain to my patients, when you get bleeding, just like if you cut yourself shaving or you cut yourself, you get bleeding. And then what happens? The blood stops and clots because that's a natural body reaction. And when it clots, it forms a scar. And on the skin, you form a little hard scab that you try to scratch off. In the retina, it's the same. So you form a scar. But what happens? This scar becomes hard on the retina and it has to pull and start to contract. And they pull until the whole retina detaches, and that's how people go blind. So this is very advanced disease. So what are the symptoms? Symptoms are when you get blurred vision and when you get very bad bleeding, or you can see red spots sometimes in your vision. But when you get these symptoms, usually it means that it's a bit too late. Not to say too late, it's a bit advanced in the sense that it's already affecting your central vision or it's already bleeding so badly. So I will tell you why we need to actually see your eyes or check your eyes regularly when you're diabetes, because we want to get to you before you get these symptoms. So for example, that's what kind of things that you could expect to see. You can get this blotchiness or blurring in the center, and you can get even some of my patients describe this redness that they see because the actual blood is coming into their vision. How do we treat? Now, just remember, diabetes is not only a disease that affects the eyes. So therefore, controlling your diabetes, meaning that you must be aware of what your sugar levels are. Either you test it yourself or you go regularly to your doctor to be tested. know that what kind of foods that you should and should not eat, how to maintain a balanced diet, how to exercise regularly, quit smoking if you do. All these are very important things that you might need to control. Don't forget about your blood pressure and cholesterol as well, because all these have an impact on all the problems that I mentioned earlier. The other way to treat is to inject some medication into the eye. Now, these injections might look a little bit scary, but has become the standard of care for the past 15 years now, when these injections first came into the market for us to treat our patients. So it contains this drug that actually has an anti-growth factor, as you saw just now. You get the abnormal vessels trying to grow. So what happens is this growth factor actually stimulates blood vessel growth. So the medication stops that, and it stops vessel leakage or minimizes vessel leakage. But the problem is you need more than one injection. And a lot of my patients find that it's difficult to understand that they need a lot of treatment, especially in the first 2 years when we start treating. Sometimes you need injection every month, and it can go on for at least 2 years before we can control the whole situation. Laser is another option. So laser actually involves, it's a slightly older option now, because it used to be the only thing that we could do for the past 30 years until we developed this medication where we can inject. That's why you see when I say treatment, I put the injection first, because that's the first thing that we would do. Following that, we might add laser. So you think about a bleeding blood vessel like a burst water pipe. So when you actually go with the laser, you're actually going to try and burn off the leakage to seal it off. But you must understand, by doing that, we are also damaging the retina, because we are using heat to burn the tissue. So we can't do that too much, because it will affect your vision also. So the treatment can sometimes be not so ideal. So laser is not the first option that we normally do now. This is just an example of what we actually do during laser treatment. And we use a lens. It's not an operation, so it's not particularly painful. We do put some eye drops, as you see just now, to actually numb the surface of the eye. We use a lens to focus the laser to actually cause little small burns, as you see in this picture here on the retina, to actually burn off the bleeding spots. And this is what laser is. It takes about 10-15 minutes, and it can make your eye a little bit blur for about half an hour because you've got light shining so long. But this is how laser treatment is done. This is an operation that actually we will do, like I showed you just now, a very advanced disease case where you lost scar tissue, you can't go to injections, you can't do laser in that scenario. You have to do an operation called a vitrectomy. And this is usually done by a retinal surgeon. So for those of you who are a little bit glee, and this is how we do surgery. Like I said, we're looking through a microscope. You got 3 little incisions, and believe me or not, the eye is actually, or rather the patient is not in pain, because we have numbed the eye completely. I know it looks a bit quite scary, I suppose, to actually be putting things into the eye, but this is how we operate. You can see here there's blood flowing around, and this instrument is put inside to suck up the blood. So you have a light source coming from my other hand, and you have scar tissue that we have to peel off the surface, as you saw just now, really bad scar tissue. And then you have little instruments to suck up the blood that's on the surface that's bled out. So when we do this, we only do it in a very advanced case where we can't actually do anything else. So after we've done all that, remove the blood, then we can apply laser during the operation, similarly as to what we're doing outside, but now we have an instrument inside the eye. So this is when you do vitrectomy for an advanced case, okay? So the other thing that can actually happen besides diabetic retinopathy or problems with the nerve layer of the eye is cataract. Now, cataract, I think people are more familiar with, but there's a little video just to summarize what a cataract is. So I'm going to share that with you.
In the healthy eye, the lens is clear and allows light rays to pass through unobstructed. As a cataract forms, the lens gradually becomes cloudy. As light passes through this cloudy lens, it is no longer clearly focused on the retina, causing images to appear hazy or blurred.
Okay, so like I mentioned, the eye is like a camera. So a cataract actually is your lens getting blurred. Now, what is the most common symptom is blurred vision. Now, everybody comes and complains of blurred vision. Cataract is one of the reasons, but there are other things that can cause blurred vision as well. But essentially, people will talk about how, like, for example, this scene, everything looks hazy or smoky, like looking through a dirty window. You can get glare. Some patients will complain that if they're going out at night, they see the lights, everything seems glary. That can be cataract as well, and hazy or cloudy vision. So what is the most common cause of cataract? Aging. Actually, age is the most common. Unfortunately, we will all develop cataracts as we age. The other problem that we can get cataracts with more commonly is something like diabetes, because when you get abnormal sugar levels, you can actually increase the lens proteins going into the lens. It causes swelling of the lens and develop cataract quicker. The other things that can do is injury to the eye, certain medication like steroids and sun exposure for too much or too long, you can get that. Family history, of course, is one of the things, and previous eye surgery is another thing that can cause cataract. Now, in patients with diabetes, there can be up to 60% higher risk of developing cataract earlier. I think as we age with diabetes, of course, we will get cataract anyway because of age. But if, let's say, you get diabetes at 30, if a normal person gets cataract maybe at 60, you might get it in your 40s or 50s because it's actually something that will make the cataract sort of grow quicker. Increased glucose levels, like I mentioned, cause the lens to swell. Now that actually can present a problem for when we try to deal with the cataract, and particularly also when you actually put eye drops to try and dilate the pupil. Actually, for diabetics, the pupil doesn't dilate as well, and it can present a problem when we try to do surgery, because that is the only treatment that we can do for cataract, honestly, is to remove it, and therefore surgery is the only treatment. So these are examples of some of the diabetic patients that I've done. You can see cataract where it looks all swollen and white. So obviously this patient can't see anything. And sometimes they let the cataract cook so long, it can be brown and very, very hard and difficult to remove. So like I mentioned, treatment is via surgery, and the surgery's got a very long medical name called phacoemulsification. Essentially, it's using high frequency ultrasound. It's not using actual laser, it's using ultrasound to remove the cataract. And this is just an animation of how cataract surgery is done. And together with that, I will play a little small clip of actually a live video that I've done to operate
Usually
when
with
I'm
cataract
operating
surgery, a small incision is made in the eye. The front portion of the thin outer covering of the lens is opened to allow removal of the cataract inside. The cataract is gently broken up and vacuumed out. Then a folded lens implant is inserted through the small incision and into the capsule, where it unfolds and permanently takes the place of the clouded natural lens. With the cataract removed, the new lens implant clearly focuses light rays onto the retina. The power of the lens implant is selected for your individual eye.
Okay, so this is on the right side, a live video of an operation. So again, you don't see the hands, you only see the instrument inside the eye. We are actually we break the cataract into little pieces and take out the bulk of the lens, and subsequently there's all these little sticky bits that we still have to remove, and we suck it out like that. At the end of that, we will have to put in what we call an intraocular lens implant, which is essentially an artificial lens, because we have removed the own eye's lens because it's become a cataract, and we have to put in another one. So this lens looks like that in the sense that it actually folds into a very small wound, small size, so that it can fit through this incision or this opening here, which is in my case about 2.2 millimeters. So you think about it, it's 2.2 millimeters, very small space, and we can operate safely through that space and don't need any stitches, and the healing is quick. So this is a standard cataract operation, and this is how the lens sits in the middle of the eye after an operation, so you can see well. The other thing that can actually happen now, moving on swiftly from diabetic retinopathy to cataract, is glaucoma. Glaucoma, I think a lot of people know, I've heard about it, and people are quite worried about it because they know that there's no cure. And essentially what glaucoma is, this video will summarize quickly for you.
In the healthy eye, a clear liquid called aqueous humor circulates inside the front portion of the eye. To maintain a constant healthy eye pressure, your eye continually produces a small amount of aqueous humor, and an equal amount of this fluid flows out of the eye through a microscopic drain called the trabecular meshwork in the drainage angle. If you have glaucoma, the aqueous humor does not flow through the drainage angle properly. Fluid pressure in the eye increases, and this extra force presses on the optic nerve in the back of the eye, causing damage to the nerve fibers. Remember, glaucoma usually has no symptoms early in its course. Proper treatment can usually stop or delay any further vision loss. An evaluation for glaucoma is particularly important for those over age 60, relatives of people with glaucoma, people of African descent, and those with elevated eye pressure.
So glaucoma is basically a disease of eye pressure being too high and damaging the nerve. So when it damages the nerve, what happens? It actually slowly takes away your vision without you knowing, because when it first affects you, it's the side vision that goes first. That's why it's often called the silent thief of sight. And because it affects the peripheral vision, a lot of people don't realize it. And when they do notice it, it's actually very late. And when they come in, when it's too late, we can't do anything and they've lost their vision permanently. So an example is the image here where somebody looking out onto a street. This is how a normal person would see. If you have early glaucoma, you might see some blind spots on the side, which you may not notice because what you want to look right in the center is still quite clear. And slowly, it becomes more and more towards the center. And in a very late advanced stage, you can end up with a tunnel vision. So people will, when they come at this stage, we can't actually restore your vision anymore. Not like cataract. If you actually find that it's blurry, we operate and becomes clear again. Whereas glaucoma, once damaged, it's permanently damaged and we can't restore the vision. So it's very important to catch glaucoma early. So again, age is another problem that causes glaucoma. It doesn't happen in everybody, of course. The risk of getting glaucoma is quite low in the single digit, probably less than 5%, 1% even. But when you're getting older, there's a risk of developing that. And because when there's no symptoms, you don't know when you're going to get it. It needs to be actually having a regular checkup to pick it up. It's associated with certain diseases. Diabetes is one of them. That's why I'm mentioning it here. When you have diabetes, your risk of developing glaucoma is also higher. And when you have inflammation or previous infection in the eye or previous injury to the eye, then you can also get glaucoma. But in the case of what I'm talking about here is for people who are diabetic, so you got to beware. What happens in diabetes and glaucoma is because there are two types of glaucoma you can get. In diabetics particularly, more common is the open-angle glaucoma, where just now we saw the video, it talked about how fluid drains into this area through an angle within the eyeball. So this angle is like I always explain to my patients, it's like a drainage area. So how your switch or your pipes actually drain out the water, there's a little opening for the fluid to get through. And in open-angle glaucoma, the drainage is actually a bit blocked. It's not to say that there's no space, it's just that it's not pumping out the fluid normally. And this in diabetes is more common because people have talked about how the increased sugar levels affects the blood flow and oxygen supply to the nerve head, so it's more prone to any pressure changes. The other type of glaucoma that is very dangerous in people who are diabetic is what we call rubiotic, or this is where actually you get a very sudden increase in the pressure and it can be very painful and it can go blind very quickly. This, in the medical terms, we have actually called it a 100-day glaucoma, in the sense that when people present or come to us with this type of problem, if we don't manage it within 100 days, they can go blind very quickly. So rubiotic glaucoma is a problem that we do see. This is a video of a patient I saw not long ago. He does have this rubiotic glaucoma. And this is an image that I took when I examined him. As you can see over here, I will highlight in the video, just showing you that actually he's having active bleeding from the actual drainage area. So it's like a waterfall of blood coming from the area, trickling down all the way across inside his eye, and it's actively bleeding. So this is one of the problems that we don't want to see, but we are still seeing, and unfortunately, this very bad outcome for these type of patients. So the treatment of glaucoma is usually eye drops first, because there are good eye drops that we can use to, when you put in, that will lower the eye pressure, but the eye drops go in lifelong. You can't stop. You have to keep putting the eye drops. The other thing is, again, injections. So those injections that I mentioned earlier, they can also work in the type of glaucoma where you get this bleeding and blood vessels. They can actually stop those vessels from bleeding. We can do laser because it's actually bleeding. We can laser off the bleeding vessels and reduce the amount of bleeding there, and hopefully reduce the pressure. And ultimately, we have to create opening for the fluid to drain if there's no drainage possible, just to lower the pressure. So this operation By tradition, it's called trabeculectomy. And again, this is an animation to explain a little bit
This
about
procedure allows your ophthalmologist to create a new drainage channel for the eye. The trabeculectomy allows fluid from the eye to flow into a filtering area called a bleb. The bleb is mostly hidden under the eyelid. When successful, this procedure will lower the pressure in your eye, minimizing the risk of vision loss from glaucoma.
So that's just essentially a drainage operation. So you got a system or an eyeball where there's blockage or there's no flow so that the pressure is so high. So you just create an opening for the flow of fluid to come out slowly. And this is a trabeculectomy. This is what we have to do surgically when we cannot control.
This procedure allowed.
So there's a newer procedure. Well, there are newer procedures. It's not just one. And one of the things that I've been doing more of recently is only for the types where there's an open angle, where there's actually space for fluid to flow, but the fluid is not flowing out quick enough and the pressure is too high. So we are placing little stents in to actually drain this fluid out. So if you look at this, this is they call it the eye stent. This is an American penny. It's quite small. It's sitting on this is actually a life-size, not life-size, I would say a proportionate size of how big this stent is. So it's actually very, very small. And it actually sits inside the eye. This is an example of a patient that I put one in, and this is how it looks inside the drainage angle. It's very, very small. And just a quick video of how it's actually done. It's not a very difficult operation. A lot of the time we combine this with cataract surgery. So for patients who have glaucoma and then they have cataract as well, when we operate, we put in one or two of these stents where we just use an instrument to inject this into the drainage angle as you see there. So it's a small stent that stays in. You don't feel anything that's poking the eye because it's in the area where you won't have the nerve endings to give you the sensation. And usually we put two little stents to control the pressure flow from the eye. And it's one of those things that we can do now. As you see, more and more new things will come out in medicine and especially in ophthalmology over the years. And we have to improve the ways that we can treat. So for the past half an hour or so now, I've told you a few things. The three main things that I've talked about is related to diabetes. So I want to say first, the first thing you must realize that if you are diabetic or you know somebody that's diabetic, let them know that this is something that you have to live with. You can't stop diabetes or cure diabetes, not at the moment. Maybe in future there's something you can do to completely cure it. So you have to keep taking medication and look after yourself to ensure that you don't get so many complications from diabetes. So prevention is always better than cure. So live a healthy, balanced life, balanced diet, good exercise, and get your eyes screened regularly, because when you detect things early, it is very important to prevent you from getting more problems in terms of blindness and vision loss. So how often should you get your eyes checked? I think this is important. If you have type 1 diabetes, if you remember what type 1 is, usually those who have type 1 are diagnosed very young, sometimes even in childhood, in your teens or something, because you find you get all those symptoms. And when they test, they realize that you don't have any insulin, so you have type 1 diabetes. So you need your eye checked within 5 years of diagnosis. That's the best. If you have type 2, where you can have some insulin, but not enough, and your sugar levels are still high in the blood, you need to get your eyes checked when you're diagnosed straight away. So that when I say eyes checked, I mean you go and see an eye doctor where they put eye drops and have a look inside to make sure that you don't have any bleeding inside your retina. Now, following that, how often should you go? I think people have talked about at least once a year. I think in my practice, I want to tell my patients at least every 6 months, if you can, every quarter, every 3 to 4 months. Easy to remember because diabetics need to go and get their blood tests, meaning that not just your finger prick, you need to go for a blood test where they take blood out and they go and check a particular marker called the HbA1c, which gives you your average blood sugar level, should be around 7 or less for the people who are already diabetic. And that should be done at least every 3 months. So if you do that every 3 months, get your eyes checked at the same time. I think that's a good practice anyway. If you are pregnant, if you are diabetic and you get pregnant, I think you should have an examination within the first 3-4 months of when you get and you realize you're pregnant, because in people who are diabetic, when they're pregnant, you get a lot of hormonal changes. It can actually make the diabetes in your eyes get worse. So you take note for that for the ladies. Unfortunately, there is this complication. If you have already got other problems, for example, from diabetes, then you're already having kidney problems, or you're already on dialysis, or you've actually had problems with your feet, or you had to have an amputation or a previous stroke or heart problems, then you definitely need to get your eyes checked because you're already having a lot of complications from diabetes. Okay, so hope in sight is the theme for this year. So I like to share all this with all the viewers today, and hopefully there will be hope that you can see the fact that even if you know or you are diabetic, get yourself checked regularly so that you will not be able to, you will not suffer the complications of diabetes. So as part of our World Sight Day initiative at LEC, so aside from this webinar to inform you about diabetes, we are giving out slots for people to come in to get their eyes screened. And those that actually attend here, you register yourselves for eye screening, or we can get back to you and give you a slot to come in at certain designated time points in the coming weeks where we can give a free screening for everybody. So thank you for your time. And I hope I wasn't giving too many scary videos there, but I look forward to answering more questions. Thank you.
Thank you, Dr. Lee. Thank you. Okay, so now will be the Q&A session. But before the Q&A session, like what Dr. Lee said, we will actually offer the free eye screening for all the attendees, whether be it from the Zoom or via the Facebook live. We will actually share a link for you to register for the free eye screening, to entitle for the free eye screening. So if you can do this after the session, all right? So you don't have to do it now, so that we can proceed with our Q&A session with our speaker today. So we have one question from Wai Teng, Dr. Lee.
Okay, she's talking about IPCV treatment for diabetic patients.
Yeah.
IPCV sounds like she's already well versed with all these medical terms. Whiting, IPCV. I think you're referring to, I will give a long name here, idiopathic polypoidal choroidal vasculopathy, which actually is a separate disease. I hope that's what you're asking. So this is when, in your question, a patient who has diabetes so happens to have this other condition. So this condition actually is a form of macular degeneration, where you have an abnormal blood vessel that's leaking. So the treatment is going to be injections. So those injections that I mentioned just now for diabetic patients, they're also used for people who have macular degeneration, because it serves the same purpose, in the sense it tries to reduce the amount of growth factors so that the blood vessels stop leaking so much. And in the sense with patients who are diabetic and happen to be IPCV, we just give injection. If they happen to have both conditions that require injection, so the injection is treating both things at the same time. But you do need multiple injections. I can say, unfortunately, you'll need most likely somewhere along the lines of 8 to 10 injections in the first year, one every month. It's quite a lot of treatment, but unfortunately, we don't have any other option now to try and maintain your vision. That's IPCV. The other question I see here is, how does smoking affect the burst of retina? Burst of retina means that I think retinal blood vessels bleeding, maybe. Well, smoking is bad, really. I think, well, before my time, before I was born, I think there was a lot of advertisements, I'm sure, when smoking became a big cool thing to do. I think there were actually people that had adverts on the TV, people smoking. I think you don't see that anymore, because I think in the last perhaps 30 plus years, people know that actually smoking is bad. So not just in the sense that it causes lung cancer, but we know smoking can be linked with so many different things, because all the toxins that we're breathing in from that little cigarette stick has got tar, nicotine, all kinds of funny chemicals that can damage different organs. So no different in the eye. In the eye, most likely it will damage your blood vessels. So already, if you're diabetic, you have problems with sugar levels causing leaking from these blood vessels. If you're also smoking, you're contributing to that as well. So essentially, it just weakens your blood vessels and increase the risk of bleeding. So smoking is bad. Anything else from Facebook? Any questions or?
Facebook at the moment. Okay, Dr. Lee, let's say if a patient is actually pregnant and also have diabetic and requires surgery. So can this patient actually proceed with the surgery?
Well, of course, we got to look at the whole scenario in terms of the kind of surgery we need to do, firstly, how extensive the problem is in the eye that requires surgery, and balance that with the overall stability of her pregnancy, like at what stage is she pregnant, is it the early stage, the late stage, is the baby okay, all these things you have to work in conjunction with the obstetrician, and we have to be talking to know that if she needs surgery, we can go ahead. Because one of the concerns is sometimes when we do this type of surgery, we also inject those medications into the eye. And the concern, of course, is any of that drug gets into the system of the mom and passes on into the baby because she's pregnant. So there are instances, people report certain concerns about that. Having said that, the risk is very low because the dose of the drug that we put in is very, very low, and it's in the eye. Passing to the system, the risk is quite low, but it's not zero. So we have to have a good discussion with the obstetrician together with the patient and balance the risks. Because on one side, I mean, I've faced this situation before. On one side, you have somebody that needs surgery because they're going to go blind. On the other side, you worry about the risk to the baby and to the patient. So we have to really make sure they understand what they're going in for. And the worst case I had is when you have a pregnant lady with both eyes that are gone. You try to save at least one, otherwise after they've delivered, they're already blind. So what can you do? So those are difficult situations. That's why it's important that if you are diabetic and pregnant, go and get your eyes checked early, because before it bleeds to a very bad stage, we can most likely do laser and do a lot of laser to prevent the further bleeding. So if we catch it early, then we don't have to do too invasive treatment like surgery.
Any of the attendees from who join our Zoom would like to ask question, you can actually unmute yourself to ask question, because this is actually a interactive session now with the doctor. You can ask any question.
Yeah, it doesn't have to be related to diabetes.
Yes.
They
Any
ask
related with
really open clinic now.
open clinic, free consultation now.
Another 10 minutes.
Okay. If yes, Yvonne Yi.
Yeah. Hi,
Hi,
Dr.
Yvonne
Yi.
Yi.
Yeah.
Hello, hi.
Okay. I just want to ask you, sometimes if my eyes are itchy, then sometimes I just say I rub my eyes with the fingers. Then after that, I notice my eyes will get swollen, Is it because of the germs or the dirtiness? Is it the dirtiness of the fingers?
Well, possible, because when you get itchy eye, actually itchy eyes can be so many causes. I mean, it could be just dust getting the eye, causing a bit of irritation. It could be dry eyes. It could be a bit of like you said, germs or infection giving you the symptom. But what you do when you rub, what you're essentially doing is, if you think about it, if you have let's say you have something irritating your skin, let's say a small mosquito bite. If you keep scratching it, what happens? The whole area becomes red and it becomes a little bit swollen, because you're just irritating the area more by actually rubbing. So I would say don't rub your eye. Of course, sometimes it's easier said than done. We forget and we just rub. What is better is if you just get some eye drops first. You can get simply some artificial tears. We get it from either pharmacy or wherever, if you have some in the house. And you put some drops in first to try and see whether you can wash out whatever is irritating your eye. And if it persists and the eye becomes more and more uncomfortable, of course, you've got to get it seen to get it checked rather than just keep rubbing it. It can make it worse sometimes. Yeah. So
if let's say if we are outside, we don't have any eye drops, so how to cure the itchiness if we are having it at that time?
Well, I think if you really don't have any eye drops, then rather than rubbing it too hard, maybe you can even get to the nearest place to get some eye drops. Or if you actually end up with, if you know, for example, I think this is more like an emergency situation. Let's say, so some people, they get some chemical in the eye. We actually say you can even use tap water. But for what you're describing, is not that scenario. So I wouldn't use tap water either. So usually it won't be so itchy and it's so uncomfortable. But if you can, have some eye drops with you, carry them with you. If you're prone to developing these itchy eyes, you can get a little box or a little bottle of eye drops that you can carry with you, and you can use that frequently. It doesn't matter because it's just lubricants.
Okay.
If you're prone to that, carry something.
Yeah, very prone to that.
Yeah, then you should carry something with you, because maybe where you are, you get some dust or something irritates you. Yeah.
Oh, okay. Thank you, Dr. Lee.
Okay, you're welcome.
Anyone else would like to ask any question? Yes, Lau Man Fong, you can unmute yourself. Lau Man Fong?
Oh, she raised her hand.
Yeah.
Maybe she did it accidentally.
Lau Man Fong, you can ask your question.
Hello, Doctor，
Hi,
你
hello.
是讲华语或者是广东话嘛？
可以。
Okay, 冇問題，冇問題。
Actually 我 father 係咪佢
啊
上個月啱啱做嗰個 cataract 嘅手術
Okay.
，but then 佢係9月9號咁樣做嘅，但係 so far 係咪佢到而家佢都係話佢嘅眼睇嘢好 blur，其實咁嘅情況係屬於正常嘅冇？
Well, actually 咁樣要睇一睇佢做手術，後面佢有冇甜療啊，一係有冇其他病嘅咧？
佢有少少血壓高 ，under 已經係有食緊 medicine 嘅 control， then diabetes 嘅話係冇咯。
OK， 都做咗眼膜手術 cataract 啦，所以變咗佢有時如果佢嗰個傷口嗰度有啲腫啊，佢恢復嘅時間要耐啲，同埋如果佢係佢嗰個眼完全未恢復晒，一時佢滴緊藥水啊，佢個眼仲有啲發炎啊，一係有仲有啲紅啊，一味會影響到佢睇嘢唔係咁清啊，一係佢而家配咗有配眼鏡未啊？
配眼鏡啊，
因為通
冇
常如果佢睇下用咩鏡片啊，如果佢用咗普通即係所謂講佢個鏡片係俾你睇遠㗎，一係佢仲有散光啊，變咗佢睇嘢仲未清，因為佢未配到眼鏡啊嘛。所以我唔知佢做個手術係用咩鏡片嗰啲，所以嗰啲要睇到先清楚。
嗰陣係講配可以睇近又可以睇遠嘅，因為我考慮到佢會有揸車，所以我就講我攞咁嘅 lens， 但係我又擔心唔知係嗰個讀得嘅問題定係我發得自己嘅問題，所以我就
明白，
驚佢嘅問題係處於唔正常咁樣，因為已經好耐 about 一個月多啲咯。佢都同我講唔係好真啊睇嘢，所以我就有啲擔心咯。
因為有時你而家係選擇咗呢啲 so called 睇遠睇近嗰啲，我哋英文叫做 multifocal 嗰個鏡片啦。所以佢嗰啲咧，有時佢需要時間適應，同埋如果佢另外嗰邊未做咧，有時佢未可以 balance 到啊。如果佢淨係做一邊，有時睇嘢啊，好似唔平衡咁嘅樣。所以佢另外嗰邊做咗未？
就係未做咯，所以我喺度考慮緊，我唔係幫佢換一個 eye specialist。
係就係有時咧，好多時啊，有人係用咗呢鏡片，佢哋先要明白，通常用咗呢啲鏡片要兩邊眼做咗先可以兩邊 balance 用到。第一，第二你用到呢種鏡片，佢有時佢唔同嘅光線之下，佢睇嘢咧就有時會爭啲嘅喎。有時佢係夜晚出街啊，可能見到啲燈比較散啊，同埋最主要咧，佢而家係要佢 check 到啦，我哋要 check 到佢個度數嗰度。係仲有冇散光啊？仲有冇少少近視，一係遠視嗰啲，因為佢會影響到佢嗰個佢睇嘢嗰方面有幾清咯。所以坦白講，而家成個月咗，如果我即使未正式睇過眼，就好難講係咩問題啦。所以有幾樣嘢可以發生。
因為佢另外一邊眼佢就有 infection， 但係佢嘅 infection 係咪滴藥水食藥，又係食翻個 doctor 配嘅藥啦。好似都係冇 improvement 咯，我睇到，所以我就好擔心佢一邊眼又做咗 cataract， 一邊眼又咁樣 infection。
所以如果係咁樣嘅情況 ，actually 我而家因為係講到呢度，如果我冇睇過佢嘅眼，就好難講係咩問題啦。不過頭先我係推測係有邊幾樣嘢可以影響到佢覺得唔清。不過如果正式清楚要知道，我要睇一睇嘅先知道。
OK， 好，唔該你，我帶佢去你診所。
冇問題。
Okay, thank you, Lau Man Fong. Dr. Lee, we have one question from Facebook. Okay, the Facebook attendees. She asked is actually from the question from Jean Lee. Her question was, many years back, she did LASIK surgery. So in future, if she developed cataract, will it be a more complicated surgery?
Well, the complication usually does not come from the actual surgery itself, but more so from the planning. Because what happens when you do LASIK, we change the surface of the cornea because we laser away tissue to allow the eye to focus. So when we do that, how that affects is basically when it comes time to do cataract operation, we have to measure the eye to choose the correct lens power to put into the eye. So the lens power calculation becomes a little bit less accurate when you've actually had some laser surgery before. But having said that, you know, the methods that we use nowadays are getting better and better. So we are still quite confident to be able to get the correct power lah. So it's not, say, a complication, but it's something that, you know, nowadays do see a fair few patients that have had LASIK before that are now coming into the cataract age. So it's a matter of explaining what to expect. And if there is somehow when the power is not so accurate, what does it mean? It just means, doesn't mean you go blind. It just means that perhaps if you want to see clearly after cataract operation, you might need a pair of glasses, or we need to do some adjustments again after that so that you can see clearly without glasses. So that's one of the main things. I won't call it a complication, but it's something that we have to be mindful of and plan for it properly. The other thing, of course, when you've had LASIK, your eye becomes more dry. And sometimes when it comes time to cataract surgery, after cataract surgery, your eye also gets more dry. So some people suffer with more dry eyes after cataract surgery. And that sometimes can be uncomfortable, but it's something that can be managed as well, usually with eye drops, and we can pre-manage it before surgery. So you have to let your doctor know. If you've had LASIK before, don't hide the fact or try to remember that you had LASIK. Some people have been so happy with their vision for so many years and then they forget that they've had LASIK. And what happens, you do get a surprise. Sometimes we don't actually see the wound on the cornea, and then, you know, the doctor doesn't know. But most of us will know, because when we do measurements, we can tell, hey, this looks a bit different. Then we will know that you've had LASIK. But whenever when you see a doctor and they ask you about your history, remember to tell them you've had LASIK before.
All right. Thank you. We have one question from the Zoom attendee. Dr. Lee, after the trabeculotomy or stent implant, does the glaucoma patient still need a lifelong eye drops?
Okay, that's a very good question. So I think the main objective of this surgery is to allow better control of the eye pressure. It's not really to say that after you do the surgery, you don't need eye drops anymore. I don't really say that to the patients, but I say that that might be a useful benefit on the side now. So the primary objective is now, okay, we can't control your pressure, or you can't use the eye drops because you're allergic to the eye drop something. So we need to do something so that we can control the pressure. So we do an operation. So after the operation, the pressure is better, but if we need it to be even lower, you might still need to use eye drops. So if so happen that it gets low enough that you don't need eye drops, that's great. So how do we decide whether it's low enough? We have to do a lot of tests. I think right on earlier on just now, when you looked at the early videos before we all started, there was some of the machines being used, and all those are part of the things that we use to measure the eye, to decide whether there's any damage from the glaucoma and whether we need to lower the pressure more. So every patient might need a different eye pressure to stay safe so that they don't lose their vision. So a lot of patients will say, oh, 20. I mean, if you have patients that have glaucoma, they say, oh, 20 is the magic number. If it's less than 20, it's good. Actually, that's not true. Some people can tolerate 20. Some people cannot tolerate that and need 15 or 14 or something like that. So every patient has to be checked properly, and we know how low the pressure should be. So we plan for that.
Okay. I'm just wondering, Dr. Lee, if let's say we talk about would hormones actually affect the diabetes and then probably affect the glaucoma, or, you know, affect the cataract? Well, actually, because like nowadays, people are more stressful, so their hormones will just fluctuate and go up and down. So will all these actually affect glaucoma and cataract, or even their diabetes?
Well, if you're talking about stress itself, you know, can be a whole other topic. I think there is some evidence. I wouldn't say it's definite proof, but there's evidence that stress is linked to a lot of things. Stress is linked to heart disease. Stress is linked to diabetes, one of them. Stress is linked to cancer even. So what happens when individuals get stressed? You get release of a lot of different types of hormones. You know, one of them, you get adrenaline, you get all kinds of different hormone, cortisol increase, levels increase and all that. And yes, they can have an impact on all the different organs around the body. So I believe if you're talking about being stressed and being diabetic, course, it doesn't help, but it's very difficult nowadays to say to people, okay, calm down, don't get stressed, because we are all living in a life where stress is something that we all have to manage, and particularly now we're all not stuck at home, but with the situation around the world, how not to get stressed? So everybody gets stressed. We just have to be aware and learn how to manage them. So I don't think there's a definite link to say that stress and all that will make diabetes worse, but I think it probably has a role to play as well.
I'm just wondering, anyone will have any other questions from the attendees? If yes, you can either unmute yourself or raise your hand. All right. Then if no, just want to remember to click the link to register for the free eye screening. All right. So the registration will close by tomorrow at 5 p.m. So please register, and the free eye screening will be strictly by appointments, because we want to really adhere to the social distancing. I hope you all would understand. So will be strictly by appointment. So once you register via the link, we will give you a call to make an appointment for you to see our doctor.
When you say the link, is this link here that says webinar feedback, is it?
Yes.
Okay. So for our Facebook and YouTube friends, will they have that link there as well?
Yes, we will also post the same link in our Facebook as well in the YouTube channel. So it applies the same. So you all can do the registration later. So any more questions from the crowd? If no, then maybe we can take a group picture from the Zoom attendees.
Okay. All put your cameras on.
Yeah, can you please on your camera? While waiting for our attendees to turn on the camera, just to inform again, for those who actually came in later via the introduction earlier, we actually, if you're not comfortable in leaving your house and you have minor problems and you would like to consult the doctor, we also have this teleconsultation. So you want more info, you can actually go to our Facebook page or our website on how the steps to make an appointment for the teleconsultation with our doctor, and there will be no, it's actually free of charge. Okay, so for existing patient or you need a continuation of your eye drops and your medication, so we also can deliver to your doorstep as well, so without you leaving your home. So I'm seeing more people turn on their camera.
Are you sure you can fit all the people on here?
We probably have to do 2 rounds, okay?
It's just about nice.
2 rounds. So just give me a second. Okay, so everybody, when I say smile, 1, 2, 3, smile, you all pause and don't move, yeah? 1, 2, 3, smile. Okay, one more on the other group. 1, 2, 3, smile. All right. Thank you, everyone. Thank you, Dr. Lee. Thank you for your time. Thank you, everyone, for your precious time to join us for this awareness in conjunction with World Sight Day.
So when is our next one? I think we're going to have more and more coming, right?
Yes, we will have more and more to educate the public. So please click like our Facebook, and then you will actually get the updates of our next webinar. It will be on a different topic with different doctors. Okay?
Okay.
Thank you, everyone. Thank you. Good night.
Good night.
Please send a photo to us.